Okay, good afternoon, everybody. Thank you very much for joining our webinar today, where we'll be launching our Advanced Practice Governance Maturity Matrix. Thank you all very much for making the time to come to the webinar today. My name's Dr. Julian Barrett. I'm the lead for the Centre for Advancing Practice here at Health Education England, and I'm joined by my colleague, James Pratt, who's the lead ACP at Nottingham University Hospitals NHS Trust in the East Midlands, and also by my Centre for Advancing Practice colleague, Eloise Greenwood, who's our National Advancing Practice Programme Manager. So there'll be an opportunity for you to ask questions as we go along in the webinar today. So we have a Q&A function, and we will either answer those questions as you post them, or alternatively, we'll also make some time for answering those questions and discussing them towards the end of the webinar. So today we're looking at the Advanced Practice Governance Maturity Matrix. Governance of advanced practice is inherently important. Advanced practice has been around for a long time now in the UK. We first started working on advanced practice developments in earnest back in the early 90s. And since that time, advanced practice has grown organically. So there's been but because of the way it's grown organically, there's been an inconsistent approach to how advanced practice is implemented across different types of organisations. And obviously, since 2017 and the publication of the multi-professional framework, advanced practice developments have increased at speed, and this has further heightened the inconsistent developments that have occurred in relation to the development of the governance of advanced practice in provider organisations. So it's really key that we have a more consistent approach to the governance of advanced practice. So today, our maturity matrix sets out some guidance and recommendations for governance of advanced practice in provider organisations. And a key point to understand is that it's applicable to all types of provider organisations. So for acute care, mental health, primary care, community care, it's just not for one specific type of organisation. It's important for all of those different types of organisations where advanced practitioners work. So the guidance offers an opportunity to have a shared understanding in relation to the governance of advanced practice, and a common set of expectations and a clear understanding of what should typically happen in relation to the governance of advanced practice in provider organisations. Three key points to think about the governance of advanced practice is that it's not an optional activity. So in order for advanced practice to be successfully implemented in a provider organisation, then its governance needs to be engaged with. So it's really important to think about. And within that governance, the leadership of advanced practice within a provider organisation is key to think about. So having an identified leader for advanced practice is absolutely fundamental within provider organisations. And it's really important that that lead for advanced practice within the organisation is an advanced practitioner themselves, so they can bring that inside knowledge and perspective to the governance of advanced practice, and that they have the operational and strategic overview of the implementation of advanced practice within provider organisation that they're employed in. So that's a little perspective and giving some context to what we're looking at. So I'm just going to hand over to my colleague James now, who's going to look in more detail at how we've developed the governance maturity matrix. So over to you now, James.
Well, I'm really sorry to interrupt. I'm so sorry, but I think there's two invites for this meeting because Sarah Goodhue's in another room with some other people for this. Just to let you know.
Okay.
Can we keep going on this? It's recorded, so we can send it to everybody who's out there at the moment.
And we've got quite a lot of attendees in this room at the moment in this event. Okay. Thank you, Emmy, for noting that. Thanks, Eloise. James, hand back over to you. Now, where's James gone? Is he still there? Has he dropped out, Eloise? James, oh, James has gone, right. Okay, where's he gone? Right, here we are, it's back now. Sorry, James, you dropped out there.
Yeah, apologies, I'm back now. Julian, so I just missed it. Have they joined the meetings together? Are we okay to carry on?
Well, yeah, we're going to stay in this meeting, James, that's correct, because
Okay.
we've got quite a few attendees in here, just under 100 at the minute.
Okay, right. So As Julian introduced me earlier, I'll just quickly reintroduce myself again. My name's James Pratt. I'm the Trust Lead for Advanced Clinical Practice at Nottingham University Hospitals NHS Trust. And for about the last sort of 14 to 16 months, I've been helping support the Centre for Advanced Practice in creating some resources really around advanced practice governance and assurance. And the first output from this piece of work has been this maturity matrix, which we're going to go through today. So the way that I thought I'd structure this this piece around the webinar and things was to, first of all, just to give you a bit of an idea of what the background was behind this project, talk about some of the aims which underpin it, talk about what we found within the scoping and what we found from organisations when we spoke to them about what was currently in position from a governance perspective, go through what the role is of the provider organisation, and I think that bit's really key and important. Julian's already emphasised that in his initial introduction there, and then finally just actually take you through the maturity matrix so you can have a look at what it's like. There is the option to post questions in the question box at the side, and hopefully we'll get through some of those at the end. So many of you have heard Bev many times talk about flying the plane, and that we're actually building a plane as we're flying it, and that's often what advanced practice feels like. And I think going back to what Julian said, as advanced practice sort of really became embedded in organisations since the early 90s, it's been very much organic in how it's grown. And it's very true is that actually when we do look at building advanced practice services, it's very much building them whilst they're in motion, but it's also about how you land them as well. So when we first looked at this project, I had some long conversations with Bev about what we could do, and something as a lead for advanced practice in the organisation in which I work, I get approached often from people asking for advice on how to set up AP services, how to build governance assurance, lots and lots of different elements to it. And I felt there was a bit of a gap out there in what's available in the way of trying to join those pieces together. There's lots and lots of amazing work which has been done from the centre, and lots of other organisations have created, which can be used to help you support in building your advanced practice services. But it's about how you can bring them together and sort of have a single, nearly an instruction manual of how you can tick things off to make sure you get things right. So what we decided to do with this project initially was really to take three main aims. The first one was to try and scope and engage as many stakeholders as possible around what is best practice in regards to governance and assurance for advanced practice roles. And then from that, try and develop some guidance for the provider organisations on how they can introduce advanced practice services, and then building the associate governance and assurance processes. And they're the two main aims that we've been looking at the moment, and that this is one of the outputs from that initial part of the project. But on the back of this as well, the next sort of step is that we're looking at how we can start to share some examples of the best resources which some employers are using across patient pathways, which we could then share in an area which can help support people when they're looking at implementing advanced practice services. So it really started off with a lot of scoping, and I mean a lot of scoping. I've spoken to a lot of people. I've probably spoken to a lot of you on this call, and it's been really interesting. So obviously we've engaged with the faculty leads for advanced practice. We've spoken to the supervision and assessment leads. We've spoken to lots and lots of organisational bodies, from CQC to NMC to NHSE, lots and lots of people. But most importantly, we've really done a lot of scoping with the employers and trying to understand what their perspective was around what good governance is and what their frustrations were when looking at advanced practice services. So the things that we were really looking for when we spoke to them was, what did they think was really good? What was really good that was out there? What did they find were the particular challenges? What was their understanding of their role? What did they feel was their role in the governance of assurance of advanced practice? And from that, trying to then identify themes which cross-cut across all of health and social care. And that's really what we found from doing this scoping, is that a lot of the findings actually cross from social care to community care to primary care to secondary care. And then really, then what could we build in the back? What could we build on behalf of the Centre of Advanced Practice, which could be used by provider organisations to help support them? So what were the results? Well, unsurprisingly, there was a lot of differences from one place to another. So there was confusion around the language for advanced practice. Many people were getting confused between the level versus the role and the debate around that and the conversations around it. And there was confusion about where people actually start. And when you really looked at organizations as well, you'd find that some of them were confusing what was governance and what was assurance. So you'd find that advanced practitioners may have a really good, strong job description, a strong job plan, or something like that in place. They'll have clear accountability lines, but what they don't have is the assurance in place for them to be able to work at the level which they needed to work, whether that's from something like radiology requesting or from non-medical prescribing, verification of death. There was a lot of what I would say sort of superficial assurance and governance in place in some organizations. It was really interesting, some organizations who were doing it really, really well at specialty level, in the big specialty levels where there was a big national drive, things like in critical care and emergency medicine and things, where you could see there was a lot of pathways to support them nationally. But then you'd find that maybe in another specialty within that area, or in a different GP practice, if you're thinking from a training hub, that you then end up with differences between them as well. So there's a lot of differences that we saw. Something that was clear, and this goes back to what Julian said earlier, that the areas, well, the providers who were doing well had clear leadership. They had clear leadership and clear structure in place to be able to support the agenda around advanced practice. So there was also, from our scoping, just from speaking to other groups, not just from employers and the healthcare providers, was talking to people at HEIs and their concerns around what the governance sits in their organisation, and how that then relates to what they need to provide from a health education, from a higher education institute side of things. But I think the thing which really hit home for me was trying to understand what the provider's role was in all of this. And in organisations, there's lots of different models out there, and I can only really reflect on my model, which we have within the organisation in which I work, and that we have people who work in the role of advanced clinical practitioner. We have plenty of people working at the level of advanced practice as well. But what's important is to try and get some consistency across those groups, across everyone who's working at advanced level practice. Now, there's lots and lots of governance out there around the credentialing of courses and the accreditation of people who are taking advanced practice pathways at the moment. But where does the provider sit within it? And it was only when I really met with some people from the CQC that I had a bit of a light bulb moment, and I thought, actually, this now makes perfect sense to me. So the way that it was explained to me from the people from the CQC I spoke to, is that when they go into organisations, they look at various different outcomes against the Health and Social Care Act, and they pointed out there's two particular parts. There's Regulation 12 and 18, which really apply to organisations when you think about advanced practice. And that is, so I'll read these out to you because I think they're really important. So Regulation 12 is safe care and treatment and regulation. What it says is providers must make sure that staff have the qualifications, competence, skills and experience to keep people safe and in regulation. And Regulation 18, which is staffing, staff must receive such appropriate support, training, professional development, supervision and appraisal as is necessary for them to enable to carry out the duties they're employed to perform. So that's the provider's role. Now, we know advanced practice is not regulated. It is a level of practice. It is not regulated. No matter what we think about it, it's not regulated. So currently, advanced practice is seen as career development from within your regulation, which means that I'm a nurse from a professional background, but I can put in, I don't know, I can put an intercostal chest drain, for example. The governance and the assurance for me to be able to do that obviously sits with me from my accountability, but it's down to the organisation in which I work to assure that I'm able to do that our patients are protected, I have the qualifications, competence and skills to undertake my job, and the appropriate supervision and appraisal. And I think this was my light bulb moment, was so much of this bit sits with the organisation. The level of academic study obviously sits with universities, but it's how we then fit in around it to sort of triangulate around the role of our staff who are working at advanced level practice. So from the scoping, there was sort of 8 main themes which were identified, and those 8 main themes are what are reflected in our maturity matrix. There's one just around the provider governance of advanced practice roles, how we have advanced practice represented leadership at all levels, how we can build advanced practice business cases and funding, how we can think about how we can do workforce planning around there, the training and assessment, clinical practice, supervision, and CPD. Now, when you talk about governance, it dips its foot into all of these different themes, although it doesn't own really any of them entirely, but it dips its foot into all of them. And this is the difficulty with governance. Some bits like workforce planning sits very much within workforce planning, but if you don't think about governance and assurance arrangements at the point of when you're doing your workforce planning, you won't be able to build the governance at a later stage because it will come as an afterthought. So it's really important to think about these early. But these 8 main themes were identified. And what we then did, we then went out to mainly employers at this point and said, what is, under these themes, what would really, really excellent look like? And we came out of a really long list of really, really good. Now, when you look at that really good list, it looks hugely overwhelming. So I looked at the really good list and thought, oh my goodness, I have a lot of work to do in the organisation in which I work. So Bev said, well, let's try and break that down a bit more and try and think of it more and try and break it into different sections and do it as like a maturity matrix. And that's really what's come out from this piece of work, was trying then to create something which everyone could follow, no matter where they are in their journey around advanced practice, something which you could use to map yourself against, something that you could use which could help you build resilience around your advanced practice workforce and to support the workforce going forwards. And it was taking all of these of what is really, really good and then trying to think of them at 3 different levels. So we identified them at sort of 3 different levels, from early progress to substantial progress to mature, and came up with what that would look across those 8 themes, came out to lots and lots of different people again for consultation about how they felt it was and how it looked and how it would work. And we came up with what is now the maturity matrix. Now, the maturity matrix is designed to support all of the providers out there to put anticipatory governance arrangements in place. That's what the idea of it is. There to keep the effectiveness of our advanced practice services under review and to also strengthen the arrangements to optimize how our advanced practice contributes to workforce development, employment, service delivery, but most importantly, patient care. And it's made up across those 8 themes, and I will talk you through in a minute. Now, when you go through the process of using the maturity matrix, you'll find that you're maybe at different levels in different sections, and that is fine. It's fine to have different arrangements around your governance compared to the organisation that's set next door to you. But the themes are the same no matter where you are, whether you're working in a large secondary care organisation or whether you're working in a small primary care organisation. The themes are the same. You'll go through and you may find that actually some of the mature side of things you'll be ticking green in and saying, yes, I've done this, but actually there may be some bits just below that, which is within the substantial progress in the same theme you may not have done. And that's not saying that there's anything wrong with that. The point is that it can be used for different people. So I've taken this matrix, I've used it for our organisation. I've put in, and we're seen as probably a mature organisation. After doing this matrix, I'd probably say we're sort of the upper level of substantial progress. And it's quite interesting to do it. What it's helped me to be able to do is to be able to look at the ongoing strategic plan around advanced practice here. And that's what it can do. You complete it, you fill it in, it takes time, a lot of time to fill in. Okay, so quite a big document, it'll probably take you a good day or 2, and it's about having the right people in the room to fill it in. You complete it, you come up with where you think you're at, what your barriers are, what your enablers are, what you could put in place, and then that can influence your strategy going forwards around advanced practice and give you a clear strategic plan going forwards. Now, a document will not solve all your problems. That is really important to get over from this. Julian mentioned earlier about leadership in advanced practice and making sure there is a lead. Now, whether that lead is sat in a big organisation like we have here, or whether it's maybe sat someone in the ICS, or someone sat at specialty level, or someone sat within a training hub. But it's really important to have that leadership. Now, that leadership requires investment. So you need to invest in this to be able to really ensure good governance and assurance. You need to have buy-in from other people within the organisation, the partners who you work with as well. You can fill this in and you can see where you're at, but actually the investment is the most important bit. That's the key element that we need to make sure that you're doing in the background behind this. Now, I'm now going to show you the maturity matrix now. I'm just going to get it ready on the screen. So I'll just pop it up. I'm just going to look for Julian to nod to me to make sure it's on the screen. It is good. Right. OK. So the maturity matrix is an Excel document. OK, it's going to live on the Centre for Advanced Practice website initially. It will be available at some point this afternoon for you to be able to download and be able to use. Now, the maturity matrix is for you. It's not for anyone else. So there was concern from some people that this could be used as something like the CQC could use if they were to come and review your services, or the regional leads could, but actually it's here to support you, and that's what it's here to do. And all of those bodies have said the same thing. This is great. This will really help support these services in building in good governance and giving them something to work with. So I'll take you through the program. So you download it. It comes as an Excel document, which means that you can own it yourself. You can fill it in, it's interactive, and you can also print it off at any point once you've completed it. So the first page just gives you a little bit of an introduction. This goes back to really what Julian was saying earlier and pitched to what this is aimed at. It's aimed at all employers of people working at the level of advanced practice. So it's aimed at everybody. Some bits may feel like it's more applicable to secondary care. Some bits may feel like it's more applicable to primary care, but the themes remain the same. And it's just thinking about how much of what sort of level you'd need to go into that single section for. So the introduction's there. When you complete it, it will all come forward into a dashboard, which looks like this. So the dashboard, these are the 8 themes, which I mentioned earlier. As you go through completing your maturity matrix, it will mark whereabouts you are within these different levels, whether you're at early progress, substantial progress, mature progress, and then your overall, and give you a bit of an overall summary here. And as I say, at any point, you can print the whole thing off, and it's done in a way so when it prints onto A4 sheets, which is just brilliant. So the next tab at the bottom is the context. So this is going back to what I said earlier around what is advanced practice from a governance perspective. What's the role of the employer? And I hope this makes it quite clear to you when you read it, because going back to that slide which I said earlier on around what the provider's responsibilities were, that was my light bulb moment as a lead, thinking, right, so I need to ensure against regulation 12 and 18 that I am doing these pieces to make sure that these individuals can work at the level in which they're working. So what does each page look like? So when you actually get into the matrix, here is a guide. When you look at each page, you'll come to a slide which looks a lot like this. Okay, the slide looks like this. There is, like I say, the levels of progress down here. The different parts of the criteria are across each bit down here. And at the top, you'll see there'll be some main aims as well when we get into it. You go through, you mark yourself as against the criteria here in these boxes, the little drop down boxes, which will then feed into your dashboard. And at the end, you've then got somewhere where you can write some notes, obstacles, action plans, a bit. And I'll show you how that works in a minute. That's just further expanded here within the purpose. So here is the purpose of the maturity matrix, just really saying what it is again. There is an email address at the bottom there. We're really keen for as much feedback as we can get on this. This needs to be a document which works for you as employers. That's what it really needs to be. So we want to get as much feedback as you can. It's never going to be perfect for everyone if we're trying to do something across the whole of the patch. So being realistic, what can be achieved as well. But we want to get as much feedback as we possibly can. And that includes feedback about whether you feel that you're finding it really useful and actually how you've used it in the areas in which you work. Each of these 8 themes here, you can click on and they'll directly take you to one of the different areas of the maturity matrix, just as much as you can use these at the top here, which relate to the different areas, whether it's governance, leadership, workforce, etc. So different ways of navigating yourself around it. You'll find these on every single page. So if I was to go to, I don't know, provider governance of advanced practice roles, and if I was to go to that one first of all to show you, so I can click it here, or I can get to it down here, or I can get to it there. So somewhere you'll be able to find your way to it. So if I click on that, it then takes me to this page. So what are we really trying to achieve? So what we're really trying to achieve in this section is that there's an understanding of advanced practice roles within an organisation with support and commitment for an advanced practice lead role at executive director level or equivalent senior level that offers clear corporate leadership within the provider and oversight for the governance of advanced practitioners across the whole organisation. Now, you could look at that and you could go, oh, that sounds very secondary care, but you could also make, from where I work, we have an ICS ACP lead who sits very nicely in that description there. And I know of ACP leads sat within training hubs or ACP leads who are in the private sector are overseeing multiple care homes. There's lots and lots of different ways of interpreting that. What you then do is you work your way through. So if I was to think, right, from the organisation in which I work, so the provider is scoping and mapping the current advanced practice workforce. Well, that is done here. That's something we have done. So I can then turn that green. Now I know all of these sections for me are green, so I'm going to skip through them. Okay. So, but where do we have a red one on it? So, I don't know, the provider has clear overview of all individuals working the advanced practice workforce. Do you know, I don't think I do in the organisation in which I work. So I have a clear overview of where all the advanced clinical practitioners work within our organisation. So what's my obstacles? Well, the obstacles I have there is ESR, multiple levels of people working with advanced practice within the organisation and engaging those individuals. So what would my enablers be? What would be the action plan? Is that something I'm going to do over short, medium, long term? So I could write and fill these boxes in and so on and so on. I could write further notes at the bottom. You work your way through all of this and it gets more and more in detail. So you could see here then when it gets to that extra level, the organisation has a clear overview of all individuals working in the advanced practice workforce, and this is reflected on their electronic staff records. Currently, that is red where I work. It will be green by the end of next year, but currently it is red. Okay, so you can then see how from completing this, you can start to see and filling this in, it starts to build you a strategic plan. The definition of each of those black, red, amber and green is at the top here again, and then we've got our information here. Now that feeds automatically into the dashboard. So if I go back to the dashboard, you'll see now that I can see where I am in the way of getting that green bar all the way up in each of these areas. So I know I've done that. I'm down on this. So I can start to think actually, because what we found in a lot of organizations is you'd go and see them and they may have the training bit absolutely down to a T. So they have advanced practice training and assessment down to a T. But what they don't do very well is maybe advanced practitioner CPD. Maybe they're not doing that bit very well. And it's quite interesting when you see that they could be mature in one area, but early progress in another. So going back to the governance slide, so I could go back to it through here. I could go through lots of different ways. There's a section for each of these. I'm not going to go through every single one because that's for you to do. That is for your job to do, is to sit and read through all of them. Some are longer than others. So if you take something like clinical, that's quite a short one really, but actually when you think about the detail behind it, so here's a big one. The provider ensures there are consistent governance policies, guidance and systems and support in place within specialties for the advanced practitioners to work at their agreed job plan. So if you put that then and think, OK, I've got an advanced practitioner working in primary care. A patient's come in and they need referral for a radiology request. Can they actually do that? They might have the competence and capability to do it, but can they actually do it? Is the assurance there to allow them to do it? So it's those sort of things, and some of them are larger than others. So all of those are mapped down the bottom. Okay, you'll see them all mapped down the bottom here. So there's lots of different ones. Here's the CPD one, for example, which you can use. Lots of different ones in there. Now, remember, this is about governance. This is not about being the answer to all the pillars of practice. It's not about being the answer to supervision. There's loads and loads of really good resources already produced around supervision and CPD from the Centre of Advanced Practice, all of which are going to link to this going forwards. So there's already links within it, but we'll build those links better with what's out there. What this gives you the advantage of as an organisation is you can complete this. You can go to your faculty leads and say, this is where I'm at. I need support in this area. What can we do to support you in this area? And you can also take it to your trust boards. You could take it to different people. You could take it to different levels, whatever you are, specialty level, whatever, to say, look, this is what we need in place to be at that mature level. There are some links at the end, which you can see here, which you can use, which will links to the citations which are in it, but also some other pieces of work. These will grow and grow and grow, and we'll also build them into the site page as well. So, for example, if you're talking about supervision and you're doing the supervision bit on the maturity matrix, well, then actually your strategy and the answer to a lot of the bits, if you're scoring red or amber, is sat within this document here, the minimal standards for supervision. So use these as well, use them alongside the document. Right, I'll stop sharing that. Go back to quickly share this one. Oh, sorry. Let me just. I'll just zoom in on this slide as a finish, rather than trying to mess around with it. So what are the next steps? So there's a number of next steps for us to go forwards. So this is just really the sort of tip of the iceberg around this project, and that it's something which is an output, something which you can all use. But what we really need to do now is to find out how organisations are using it, whether it's of use and whether we need to change if it's on it, because it needs to change. It needs to work for employers. That's what the most important thing is. It works for employers and no one else really, to ensure that we're meeting what we see as good governance and assurance. But the next thing we need to start thinking about is what resources can we build or support around this? Because themes are going to be identified. As organisations across the country, you're going to identify themes which you need support in. Now, maybe that will raise some themes within the faculties for us to influence future work and what we're doing in the future. But it will also give us an opportunity to think about what resources are already out there. So what's being done really well in Birmingham? What's being done really well in Derby? I'm obviously very Midlands focused right now. What's being done really well in Newcastle that we could use, or the resources within this, which would then make it a really even more effective document. So I'm going to finish there.
We will be putting the link to the maturity matrix in the chat for those who are on, and then making the announcement that it's going live wider later this afternoon. So everybody who's here will get first access.
Great, that's really good to hear, Eloise. Thank you. Okay, right, so it doesn't look like we've got any more questions, so I think that's bringing us towards the end of our webinar today. James, any final words you'd like to say?
Just thank you to everyone who's been involved in doing this piece of work. I think it's a piece of work which lots and lots of employers have had involvement from across the country, and I've learned loads from it. I've literally I had a job of having to rewrite our strategy, and this has just allowed me to rewrite our strategy in the organisation. So it's been really good, really effective, and thank you everyone for being involved. And I think the real key bit now is about how it lands and make sure that it's right for everyone and you all want it, and and if there's any changes or anything like that. And I'm particularly interested in how you use it. So it'd be really good to get some case examples if you could let your regional faculty leads know about when you've used it, okay, and what you found was particularly useful, and really let them know so we can actually use those to share more when we go to sort of present it in other places. Thank you.
Indeed, yes. Thank you, James, for your input and leading on this project. It's been much appreciated. It's a key bit of work. It's been a long period of development. I think when we started the stakeholder engagement, we realised it was going to take us longer than we anticipated to do it initially, but it's been really interesting doing that stakeholder engagement. So it's very much felt that this has been a collaborative development, the authorship of this maturity matrix. So it's been really good to have that wide range of stakeholders involved in the development of it. And this will be an ongoing process of development. This is our first iteration of the maturity matrix. So as we get feedback, we can develop it further. And we very much hope it will help you in provider organisations to understand the requirements for the governance of advanced practice within your organisations, and to understand some of the key components that are required to successfully implement advanced practice and ensure that optimum patient care is provided by those colleagues working in advanced practice roles. Okay, so that brings us to the end of our webinar today. Thank you all very much for participating. We've had a high level of attendance. Over 100 people have been here during the webinar, so that's really good to see. And thank you for those colleagues who've posted their really interesting questions in the Q&A section as well. So thank you all very much for your time today.
Thank you.